2 babies with 2 heads conjoined will require 1 major surgery to make them separate.
So it's highly complicated from a healthcare point of view. It's highly complicated from an anesthesiology point of view.
Not all conjoined twins can be considered for separation. Abigail and Michaela can. The girls are joined by the skull, brain, soft tissues, veins, and blood vessels. Their surgery is scheduled to take place at UC Davis Children's Hospital on October 24th, when they're just shy of 10 months old. The surgical team
It sits sort of high in your head.
is clear-eyed about the huge amount of preparation to come. At UC Davis, that means turning to the best high-tech tools.
Pretty much all of the latest technology available, we've had an opportunity to try out and see how it'll help us.
Neurosurgeons upload the twins' MRI and CT images into a system that creates a 3-dimensional virtual model, allowing them to explore inside the babies' heads with the use of mixed reality goggles.
You can look from the top, the side, the bottom. You can rotate the 3D model. You can walk into the 3D model and look backwards to see where you are.
Now they can understand the twins' unique anatomy from every possible angle.
Over here.
The view inside the goggles shows a complex network of blood vessels, which the team will need to detangle and separate.
With this clip, do you think we can get quite proximal, maybe 2 clips here eventually as a plan?
I think that's what I would do.
Yeah.
There are tangible models too.
Luckily, we exist in a time where there is this technology that we can take CT scan data and then generate it through a 3D printer, a 3D model of the baby's skulls.
With these 3D models, the team can plan and practice the surgery.
Maybe we want to do like 75% of it.
In the operating room inside the UC Davis Children's Surgery Center,
There's custom carts all built in the hallways.
months of preparation culminate in a dry run or final rehearsal on October 23rd, the night before the surgery.
Baby Orange is coding. Surgeons cover the field. Prepare to go supine.
The anesthesia team prepares for any sudden and dangerous complications, a very real possibility during a procedure as serious as this.
There can be significant blood loss, and that blood loss you can't really give to one child or the other. It could come from either, it could come from both.
1, 2, 3, and move.
The babies will need to change position and be turned over several times during the surgery, lifting them head over heels.
Any piece of equipment can get entangled, their bodies can get bruised, they can bang against another surface, so we are very careful about how we move patients. That's with one patient. Imagine 2 patients joined together.
The team practices these precise movements over and over. With more than 30 people in the OR, the team members are divided by color. The leaders, neurosurgeon Michael Edwards, plastic surgeon Granger Wong, anesthesiologist Raj Damrate, and nursing lead Aida Benitez don black caps. Not just any black caps.
We were the guardians of the babies, so we used Guardians of the Galaxy hats.
The team in purple will take care of Michaela, while Team Orange cares for Abigail. Purple and orange masking tape label the equipment for the 2 teams in the operating room.
It is choreographed much as in a ballet so that everybody knows their role at a given time, and we've undergone rehearsals now for months preparing for this case.
Damrate and Benitez have led the OR team through the months-long planning process. They will serve as co-captains in the operating room.
Essentially, my job was done. I had gotten everybody to that finish line, and all they needed to do was walk past it.
It's now hours before the surgery. The babies have breathing tubes inserted, and their mother Lilia says a tearful goodbye. The big day is finally upon them.